Thank you so much for the warm welcome. Uh, Very warm welcome to all our friends who were part of today's session. My name is Apulak. It's an absolute pleasure to get a chance to speak to all of you. We have a stellar panel post this, great sessions beyond that as well. But before we do all of this, I just thought I'll walk you through and give you a context of how Think Teal looks at a very, very important vertical. As you all are aware, I mean, the last 2-3 years has been very, very demanding for the healthcare sector. But as it is said, necessity is a mother of all many inventions. So I think for reasons better left undiscussed. I mean, for I guess to a large extent, the COVID has been a blessing in terms of tech adoption across. And I'll make my case even stronger as I take my presentation forward, right? So without further ado, let me take a step back and walk you through the history of healthcare, at least in India, right? As you all are aware, everybody who has gone through the crisis of COVID, I'm sure most Indian citizens would have used the Arogya Setu app, right? This was an app from where we could download our vaccination status. We could also check how many cases were there, and it gave a lot of information. But do you know that Arogya is a Sanskrit word which actually precedes way back into history during the Indus Valley civilization? The term Arogya is basically, annihilating diseases. And if sources are to be believed, during the Indus Valley civilization, there was a time when actually public health was administered even back in those days. So when they say that India has been the foundation of many, many so-called innovations and discoveries, healthcare even in the healthcare sector, as far as public healthcare administration goes, it dates back to as old as the Indus Valley civilization. In fact, to further corroborate this, back in around 8399 to 414, there was this Chinese traveler, Fahian, who spoke about how healthcare practices are done in India, and how curative care facilities are developed across the nation. So I think we as a nation have come a long way since then. We are a nation now collectively about close to about 1.4 billion people. And one of the largest challenges that the healthcare sector, when I say healthcare, I'm including the healthcare providers and the life sciences ecosystem as a whole, of how they tackle a very big challenge of giving access to quality healthcare to the remotest corners of the country. Typically when we speak about healthcare provisioning, we know that, and I don't want to rattle out the data, you are aware of the data, the number of beds per 100 people, there is a significant gap. But the last 2 decades, and I'll espouse on this story further, have been very significant in terms of the kind of adoption we've done as far as technology adoption, as far as ICT goes. It is very, very rightly said, tech adoption by and large has been there in the healthcare sector. The fact that we've been using the X-ray machine for so many years now, there is radiology, there is pathology, and all of that needed technology. But when we speak about digital transformation, it's been, I guess it would not be unfair to say that in a very big way, the last 2 decades have given rise to various forms of digital health models. We know of many applications, which have helped us in giving access to proper healthcare, reaching out the right medication at the right time, right? The concept of telemedicine also came into virtue in the last 2 to 3 decades. There was advances in vitro diagnostics, which was till to about 2 decades back, it was in vivo, right? And not to leave out cross industry convergence, because for the success of the scale of administering healthcare, it is important that a lot of industries coexist and converge to reach out to the last mile, which is eventually the patient here. And the future that when we speak about future, the healthcare sector, I would say, is not very different from any other vertical. It is definitely going to foster around innovative solutions. There will be a lot of emphasis around security, AI, ML, big data, and a fundamental way of how healthcare is provisioned by the provisioners and how it is taken by the patients. More about this as we go up in the next couple of slides. But to say all that, I think it's very important we again draw a line in history to understand, has pandemics really played a critical role? So let's look at a data point here. So if you see, I mean, not to mention these are the only pandemics that have been hit, that have plagued humanity, but we're just taking the 20th century and the 21st century. So if you've seen in the 20th century, one of the large pandemics that took place that was back in Europe was the influenza A pandemic, which was back in 1918, and 214 countries were affected by it. So it originated from it started Europe and it spread across the world, right? Then back in 2004 was the SARS-CoV-1, which was from 2002 to 2004, it had by 30 countries. Then you had the Zika virus, which was primarily contained in Africa. It went to certain parts of America and APAC as well. Then you had the MERS, then the Ebola virus again, which impacted certain parts of the world. And finally, the current ongoing pandemic, as now it's been popularly called as a COVID-19, which was the truly global pandemic, which was, I would say, in purely in terms of sheer volume and the extent of disruption it did, it would not be unfair to say that this is the one which kind of was as big in terms of influence as the one back in 1918, which was the influenza A. Why I am giving you these data points, because I'm sure as healthcare providers, as IT decision makers in your respective organization, these data points are not new. But what is important to drive an analogy is, because of these COVIDs, because of these pandemics, the healthcare provisioning was pushed to rethink, was pushed to its brink to dole out services and ensure that the challenges that were met, say, now are not met going forward in decades to come, right? God forbid something like this happens again, but it at least helps us to be prepared more than we were, say, when the COVID-19 affected us. So one of the 4 key takeouts, if I may say, A, was the improvement in spectrum of healthcare delivery. Now you have to understand this, because when something like COVID-19 impacts us, it does not see whether the containment zone is just a metro or an urban settlement. For something as profound as COVID-19, if we take just our country's example, every nook and corner of our country was affected by this COVID. But every nook and corner was not equipped to deal with COVID-19. We had a shortfall of beds, right? So purely in terms of improvement, in terms of spectrum of healthcare delivery has improved. I was talking to a very, very prominent CIO from the healthcare fraternity, and he was saying, unfortunately, COVID-19 again has, we've seen a rise in number of cases very recently. But what we are seeing is our hospitals and our healthcare provisioning systems are far more equipped than they were even just 2 years back, right? Again, another important thing that has come up is a lot more emphasis on digital health. People understand that it is not necessary for us to visit a healthcare center all the time if the work can be done through digital health. more about this in my subsequent slides. And how are we equipped to manage readiness of future eventualities and accelerate digital transformation. But when we speak about digital transformation, as an analyst, I am of a very firm view. Whenever any enterprise, and when I say an enterprise, I include all the enterprises which are part of the life science and the healthcare sector, they would never undertake a digital transformation until and unless there is a business case. No money is spent on technology just because it's fancy. So let's see what are the pivotal use cases in the healthcare sector which has pushed digital transformation in this particular industry. First, and very importantly, as you can see, when we talk about digital transformation, it pivots around trust. How can digital transformation enhance the customer-patient trust? Because I'm talking about a time when a lot of people are are providing healthcare not the conventional way, right? But in order to do so, it is very important that the customer-patient trust is not broken and is elevated to a different level, right? Then there are obviously issues around enabling the workforce, improving operational efficiency. But a very, very important point, and which is why I kept it at the last, is improving the patient engagement. Because gone are the days, when a healthcare provider saw every aspect of business, but did not give the due diligence to patient engagement. In today's competitive environment, where every healthcare provider is pitted against each other, this could be a business differentiator. Not only are we competing for the best equipment or the best doctors, but also the patient engagement and experience. Because at the end, this is a business which is not very different from any other line of business. Hence, it is important that due diligence is given to patient engagement as well, right? So clearly, when we talk about the future of healthcare, there's certain business imperatives that I would like to talk about. And these business imperatives translate into important boardroom priorities from a tech standpoint. Let's look at them one by one, right? When we speak about business imperatives, clearly thanks to, in parts, the pandemic, the way we are redesigning our virtual care model is tectonic, right? In order to achieve that, there is a back-end IT infrastructure which needs to be modernized to keep pace with it. Third, when we speak about virtual care and when we speak about access to quality healthcare, how we equip our workplaces or our workforce needs to be modernized as well, right? Last but not least, a very, very important area of personalized healthcare. We've seen with the advent of AI and analytics, it has impacted almost every vertical that we know of. And why should the healthcare sector be left behind? We'll soon see very, very poignant areas where AI and analytics has been a significant development to transform healthcare and clearly to position personalized healthcare, right? But in doing all these virtuous things, it's also very important that we do not negate security. Because let's face the facts that when we speak about, remodeling our virtual care, right? The fact of the matter is a lot of our healthcare data or records is out there in the open. That would always make us more vulnerable to a security lapse, right? So that is a growing cause of concern. And let's see, is this something that is this affecting our IT decision makers? And what are some of the ways they're planning to mitigate that, right? All of this, like I said, on the right, gets converted into tech priorities. Lot, like I said, right from at the onset, a lot of focus is in and around security and privacy, right? Again, then followed by remote health deployments. Now, this is an important point. Third, by precision workstation, because like I said, to modernize your workforce, to make sure that we talk about, I think somewhere systematically, when we talk about precision workstations, it is very important that we understand, recognize one simple notion, which is true for all verticals, very true for the healthcare sector also. The device is kind of the new work environment. Wherever you are, I mean, what you need is a robust network infrastructure and a precision workstation or a good workstation to make sure that you get access to the healthcare data and you're able to impart what was required at the end, right? Then again, the areas of data analytics and automation coexist, and we'll soon see how they are impacting person's health. Let's take the care system redesign as a first point. Clearly, COVID has had a deep impact on this particular area. If you see, numbers clearly dictate 35% people used virtual healthcare in a pre-COVID environment. Either they used it or they had a proclivity to use it. Now that number has driven up to almost 74%. In other words, 3 out of 4 patients, are open to the idea of having virtual healthcare. And to corroborate that, I mean, see, whenever you have an ecosystem, there are two parties to that. One is the healthcare provider, the one is the one who's receiving the healthcare. So while the patients are fine with the notion of getting virtual healthcare, similarly, 56% medical practitioners are also open to the fact that virtual healthcare, telemedicine is going to make a significant impact in how we impart healthcare, and it's going to be cost effective. And I'd like to take your notice here, but this was not the case 10 to 15 years back. There was resistance from both the ends. I'm sorry to call this out because I've done work for the government, and it was through our dialogues in the past about 2 decades. What we've noticed is that resistance clearly has come down. People are much more adept in taking technology going forward in the healthcare sector as well. Just to give you a few use cases of virtual health. So if you see, 87% of patients feel advanced technologies actually enable better healthcare outcomes, right? 70% of enterprises, which are basically healthcare providers, feel that real-time monitoring is significant to innovate, monitor, diagnose, and improve the patient health along with better critical decisions. But it's important to recognize one simple notion that when we speak of virtual healthcare, we're not just talking about convenience here. But had it been a matter of convenience, this would have been a short-lived experiment. We would have closed with the pandemic. What is important is to also recognize that, as I said, there is a very big challenge that our country faces of inadequate quality healthcare across the nation. Now, with concept of remote patient monitoring, imagine, I'll give you a great example you imagine giving remote patient monitoring to people who are aged in an urban settlement, right? So I think the use cases are going to get developed, and the fact that we are talking about a time where not only do we have the necessary technology, but we also have the necessary infrastructure to support all of this, including networks, right? So coming to that, when we talk about infrastructure, it's very important to achieve, value healthcare, provisioning virtual healthcare, and so on and so forth. You need to have a very robust and a solid back-end IT infrastructure. So, and IT leaders like you recognize that. If you see some of the areas that they want to focus on, right? Clearly, cloud, be it SaaS, analytics, automation, IoT, there are some of the areas that they are soon seeing, they need to modernize their legacy IT infrastructure to keep pace with the way things are changing, and more importantly, to deliver the so-called promise that we seek, be it personalized healthcare or virtual healthcare, you need a solid IT infrastructure. and modernization happens across various moving parts of this ecosystem, right? So, like I said, it has to be robust, it has to be a blend of your hybrid IT infrastructure, and also create use cases where you have high value clinical use cases which can be supported by enterprise workloads at scale. The question is, it's fine doing a POC, doing a pilot, but in healthcare, unfortunately, the chances of going wrong can be literally zero. So you cannot go wrong when you do a deployment. So given the conditions and the regulatory compliance that you deal with, it's important that when you do something at scale, it's tested, secured, and automated. And this is possible by using emerging technologies like hyperconverged infrastructure as well, right? So again, coming to a very, very important point, as I said, care anywhere and everywhere. I mean, this is like I said, this is a challenge that India has been facing for some time now, to cater to a population of close to 1.4 billion people across the geographic limitations that India holds. It's important that we enable our healthcare providers to give access to proper healthcare across. So, three important data points that come out. A, they definitely feel the right set of technology will lead to higher productivity. But having said so, it's when we talk about the right set of technology, ironically, they also further mention that too much complexity in technology can also deem as a barrier for connected healthcare, right? So it's important that we understand how we balance the two, but it is a firm opinion of many medical practitioners that through the right deployment of technology like virtual healthcare, it is possible to manage many chronic and provide behavioral care virtually. Something which was not admissible, say 10 to 50 years back, seems to be possible now, right? And to do that, like I said, again, going back to my previous slide of how important your backhaul IT infrastructure would be, it's important that we understand the concerns of the workforce and IT leadership. And to make sure that we achieve that, we need to have secure, ready to use healthcare digital workplaces or devices. It's important that they're preloaded software for remote telehealth and remote diagnostics, with minimal touch points and automated installations, update and configuration. Because like I said, we live in a world where real-time scenarios could be very different from, say, an urban development scenario, right? So providers can use the medical training to its full potential rather than wasting time on less important tasks of managing devices. It's important when it's a plug-and-play device, So hence, if you remember, one of the key points when we spoke about, challenges and opportunities around precision workstations and devices being the new way of looking at work, right? Coming to a very important area, an area which is right now firming shape. Not so much deployments have been done, but we at Teal feel there's a lot of opportunity here, which is around personal health. And to make personal health achievable, I think AI and predictive analytics will elevate, clinical decision making. But for to do so, it's important we get three important areas right. How we manage data, right? How we convert that into actionable insights, which is where analytics comes in, and very importantly, the right platform integration. The three, it's like a triad. But to do that, from an IT leader standpoint, I think three areas that they seem to be focusing right now is how do I deploy tools like AI and data analytics at scale. Like I said, doing a POC is altogether different from doing deployment at scale. Secondly, due to lack of the necessary regulations, it's very important because when we talk about personalized health, for instance, when we talk about electronic health records, it is very important that there is a ecosystem, which transmits data from one point to the other in a templatized version, yet in a secure environment. Something right now which is work in progress. We are probably not at pace with many advanced economies. So I think it's very important that a lot of emphasis is given to manage, expanding and integrating data repositories, right? And to do that, I think it's very important that you understand that you have to re-architect the data value chain, right? And as a result of this, use cases of personal healthcare could be around precision diagnostics, clinical genomics, digital pathology. This is the space that we had. There's some of the use cases that are global, but we see certain traction in India also in the near future, right? But like I said, this is my penultimate slide, but a slide which is very important is due to the advent of the COVID, came the rise of digital transformation, came with the rise of virtual health care and so on and so forth. But also timed with this were the kind of challenges that firmed up across the industry and definitely in the healthcare sector as well. So just to share some data points, so 35% of healthcare and life sciences organizations experience increase in cyber attacks post-COVID due to remote care. So 1 out of 3 IT leaders suggest that there has been a cybersecurity breach, right? And many of the breaches, let's be mindful, have come from endpoint security alone. So I think that's because when we speak about security, there is till in the pre-COVID scenario, because we were confined to our enterprises alone, right? Lot of emphasis was around perimeter security, network security, so on and so forth. But now you have to understand, when we speak about virtual healthcare, with all the data literally out in the open, your perimeter of operation has increased suddenly. Your perimeter is your patient who's taking this call from his home. So you are suddenly, your enterprise and your customer data all become very vulnerable to security breaches, right? And hence it is very important that we secure the endpoints. So it's very important to reimagine the endpoints and fructify the security around that, right? And also, they've been very candid to admit that 41% seem to suggest that they miss out on regularly updating antivirus software. Basic things like this. So how do I manage this? So one of the key areas is there are a lot of discussions around zero trust. So like almost 50% people seem to suggest you try to reduce your security vulnerabilities by ensuring least privileged access to mission critical resources, right? A lot of IT decision makers seem to suggest 43% that their spend on security is going to increase in the next 1 to 2 years. So just to sum it up, I'll leave you all with 5 key areas. They're not key takeaways, but questions that you need to answer to make sure that your strategies are in place. When we speak about digital transformation in the healthcare sector, when we speak about decentralization of healthcare, are we ready to redefine the end-to-end processes to make sure that virtual healthcare is a possibility? How are we answering the questions around data management? Do we have the technology to equipped to make data transfer seamless? Is there an ecosystem in place? Are we talking to the right people? How are you managing your legacy applications? Are they hindering seamless migration to a hybrid IT environment? Are your decision because as an IT decision maker, you may be okay with this entire concept of digital transformation. Is your senior management equipped to take this leap of faith? What is your posture as far as AI and analytics go? Do you see this being too premature right now, or should I take that advantage and having that system of records to make sure that I start focusing on in and around personal healthcare. Then the question about how do I make sure that remote care and delivery is supported by my current ID strategy, and can we make it more the entire process of lifecycle management of precision devices, is it optimized for healthcare costs as well? And last but not least, like I said, no discussion is full until we touch about security. So because there are so many moving parts to this, is there a way to secure our devices, at least used by our employees? How do do I put a mobile device management in place? Do I put a mobile application management in place? What about non-secure devices used by your patients? Is there a way to manage that as well? And will all these changes meet regulatory requirements as well? Because yours is a very, very regulated industry. Do I meet the conditions? And do we have the capabilities of our workforce to manage security infrastructure in-house? So I'll probably leave you at this. Like I said, I have a stellar panel post this, and some of the questions that we still remain unanswered, I'll try to get my answers around that. With this, it's a wrap from my end. Thank you.